From the station that's on your side, this is Channel 7 News Daybreak.
Welcome back to Time Now 6:15. Hair loss is a fairly common occurrence. While it's more common in older adults, anyone can experience it, including children. Joining us this morning to talk about this very personal topic is Baptist Health Dr. Janelle Dawkins from Sherwood Family Medical Center. Good morning to you, Dr. Dawkins.
Good morning.
I know it's early, but I appreciate you being here.
It's my pleasure.
Yes, ma'am. So several of your patients actually requested this topic because you're hearing it more and more every day. How common is it for you?
It's very common. I just wanted to come on and talk about this topic because a lot of my patients are coming in and talking about hair loss and just seeing how distressing it is for them and how it's affecting their quality of life. I want to shed some information on the topic.
So we're hearing adults and children can get it. More common, we're hearing pregnant women are experiencing hair loss. What are the common factors that can lead to hair loss?
So first of all, there are several factors that can lead to hair loss. It all depends on the type of hair loss that you're experiencing. Usually anything that changes your hormone levels can cause hair loss. Some medications can cause hair loss. Anything that stresses out the body. And usually when we talk about stress, more people are thinking about only emotional stress. But we also have to think about physiological stress to the body. Things like fevers and infections can cause hair loss. A lot of what I'm seeing in my clinic is COVID-induced hair loss.
Wow.
A lot of patients don't realize that you can lose 30 to 50% of hair after COVID for several months.
Wow. Well, is there any good news as far as what you can do if you're experiencing hair loss? I mean, many people trying the little drops to put in their hair, different types of hair oils. What's the best way to get your hair moving in the right direction? Right.
So the first thing that I want you to do is go and see your primary care physician. Some hair loss is normal, right? We're supposed to lose at least 5 to 10% of our hair daily. If you notice that you're experiencing more hair loss than that and your hair is thinning, I want you to go in and see your primary care physician. They can do some labs and they can also first delineate what type of hair loss you're having and then see if you should complete some labs. There's hope, right? We're not going to lose hope. We have excellent dermatologists in Arkansas that can help with different treatments that are groundbreaking for hair loss. Sometimes we just give the hair a break from certain hairstyles and certain heat and just incorporate vitamins.
And it's so important that you said going to see a physician because whereas some hair loss could be normal, maybe you're experiencing alopecia or something like that. And then with those type of treatments, there's actually medication for it, correct?
Right. And usually, sometimes patients come in and they don't realize that they're having an autoimmune disorder, like lupus or a thyroid disorder going on. And we can delineate that when we see the type of hair loss, the patches.
Anything about our diet that can help with hair growth, for example?
Right. So just making sure that, you have some hair, skin, and nail vitamins. Those are very popular. Making sure that you're using it from a credible source, though.
Dr. Dawkins, always a pleasure having you on our show. Thank you so much for being here. Now, you can contact Baptist Health by going to baptist-health.com or calling the Baptist Health Helpline at 1-888-BAPTIST if you have any medical concerns.